You've probably heard since you were a little girl that you should drink your milk for strong bones and teeth. This is because milk contains a large amount of calcium, an important ingredient to the strength of our bone cells. Just as a house requires a sturdy foundation, a body requires a tough, durable skeleton to support the body throughout life. If we do not have enough calcium in our diets, we have a higher chance of developing osteoporosis, which means porous bone, and occurs when our bodies lose too much calcium and become brittle. Including healthy amounts of calcium in our diets promotes the development of bones and tooth enamel and is absolutely necessary for our bodies to function at optimal levels.
Yes, it is true that calcium is most commonly found in dairy products. However, as the average woman requires around 1,000 to 1,200 milligrams of calcium every day to properly function, we can also look to other calcium-rich foods that don't all come from cows. Listen up, vegans! Some non-dairy options include broccoli, kale, collard greens, edamame, bok choy, sesame seeds, figs, rhubarb, oranges, papaya, molasses, sardines, salmon, white beans, okra, tofu, tempeh, and almonds, all of which provide significant amounts of calcium. That being said, it is less necessary to take in higher amounts of calcium if your body maintains an alkaline pH. If your body becomes too acidic, it will begin to break down your bones, requiring you to intake more calcium to make up for it. Therefore, foods that create high acidity in the body, like greasy meats, would be helpful to avoid when trying to keep up your calcium levels.
In order for calcium to benefit the bones, calcium absorption has to occur. Certain foods can block calcium absorption, especially fast foods. Salt is one of the main culprits. Sorry for the ladies going through menopause. Too much sodium makes us rid ourselves of calcium in our urine. You should avoid foods like potato chips, french fries, and salty meats. Excess alcohol intake can also inhibit calcium absorption. Too much alcohol can hinder enzymes that convert inactive vitamin D to active vitamin D. Because you all live in Hawaii, you're getting plenty of vitamin D from the sun, but we have to keep the enzymes working properly. So try to limit your nightly wine to just 1 glass. Same with caffeine. Try to limit your daily coffee to about 2 8-ounce cups a day so that you do not lose too much calcium through urinary and fecal excretion.
With a regular calcium intake, the body can balance its internal concentration in the blood, tissues, and bones so that everything can properly function. If you don't get enough calcium in your diet for the intestines to absorb the amount they need, your body will begin to take calcium out of the allotted amount that was intended to go to your bones and use it to power your internal organs. If these levels begin to fall, your parathyroid glands will have to work overtime to keep your blood calcium levels between 9.0 and 10.1. And if the levels fall low enough, even the parathyroid glands may not be able to return them to normal. This withdrawal, if prolonged, can lead to osteoporosis. Yikes!
Because the bones of teenage girls are still developing, it is important that they have high calcium diets so that their skeletons grow to be strong. It is also important that they get into the habit of eating foods that do not have acids which will break down their bones. You should also discourage your daughters from dieting to lose weight so that they get enough vitamin D and calcium. Also, as women get older, especially past 50, taking more calcium is far less effective because their bones will not accept as much calcium as they do when they are younger. So long story short, encourage your daughters to eat calcium and the right types of calcium.
Parathyroid hormone, also referred to as PTH, and calcitonin, formed by the thyroid gland, are hormones that help to maintain calcium homeostasis in the body. The role of calcitonin is to regulate the amount of calcium in the blood. It hinders osteoclasts, which break down bone and release it into the bloodstream. Calcitonin therefore keeps bones from being too broken down. It also regulates the amount of calcium absorbed by the kidneys. People with hypercalcemia, or people who have too much calcium in the bloodstream, are sometimes given excesses of calcitonin. PTH, on the other hand, comes out of the parathyroid glands. PTH increases the levels of calcium in the bloodstream, which can help people who have hypocalcemia or too little calcium in their blood. PTH helps to break down bone and bring calcium into the bloodstream. This can be harmful, however, because it helps with the breakdown of bones. Aside from this, PTH helps to reduce the amount of calcium you lose when you urinate. It also helps you to absorb more calcium from the food you eat. Too much PTH can cause hypercalcemia by helping to release too much calcium into the bloodstream. Too little PTH can cause hypocalcemia on the flip side.
Too much calcium in your blood can be harmful. This is what is called hypercalcemia, and it is most commonly caused when the parathyroid gland is overactive and produces too much PTH, which, as we said before, breaks down bones and releases calcium into the bloodstream. Too much calcium in the bloodstream can make it hard for calcium to carry out its normal functions. It can cause heart attacks and strokes, and can also make one prone to cancer, kidney failure, and bone marrow failure. On the other hand, not enough calcium in your bloodstream can be harmful. Hypocalcemia will not allow the body and organs to carry out their normal functions. If someone has a thyroidectomy, it is possible that they obtain hypocalcemia. This is because the parathyroid glands are removed as well. Therefore, PTH will not be able to get calcium from the bones into the bloodstream. However, if you are taking calcium supplements or have a high calcium diet, the likelihood of this complication will be reduced. Thank you for listening to our presentation, and remember, eat calcium and encourage your daughters to do so as well.